My topic today will be about the MR-Guided Focused Ultrasound to treat different brain disorders or neurological disorders. So why I'm talking about this subject to you? Well, the short answer is because I was asked to. But so currently I'm specializing in neurology here at the Turku University Hospital. I will be finished hopefully in the next few months. And also at the moment I'm doing my PhD thesis on different movement disorders caused or relieved by central nervous system lesions. So I haven't done like research on high intensity focused ultrasound directly, but this is quite close to it in a way, and I'll explain how a bit later in this presentation. I'm also a member of the high intensity focused ultrasound team at the Turku University Hospital Neurocenter. So there's a handful of us neurologists at TUX who have been trained to screen these patients and to observe them during the procedure and do the follow-up visits and so on. So I have treated a handful of these patients myself, so I have seen in practice how this works. I have no conflicts of interest that would be relevant to this presentation, and you can see some grants I've been receiving previously from there. So going to the basics of the terminology and these abbreviations. So if you're not familiar with these can be quite confusing at first. So basically the general term most often used in scientific literature is MR-GFUS, which is abbreviation for magnetic resonance guided focused ultrasound. And the HIFU stands for high intensity focused ultrasound. And HIFU is a method of creating permanent lesions. And it can be done with great precision and without doing any incisions on the body. Currently in Finland, we only have one HIFU machine that is that can be used to treat brain disorders, and it's located here in Turku University Hospital and the University of Turku. To my knowledge, there aren't that many of those even in the Nordic countries as a whole. So Turku does receive patients also from Sweden and Norway, for example. And so far, the HIFU machine has been approved worldwide for thermal lesioning to treat either essential tremor or tremor in Parkinson's disease. So that is what we are currently using it for, but hopefully in the future we will have more applications to use HIFU. Some of you have probably heard from low intensity focused ultrasound, so LIFU also. Now it's a bit different, but there's similar aspects. So it also uses focused ultrasound, but with less energy. So the resulting effect is not a rise in temperature that would lead to necrosis, which leads to a lesion. But the energy can be used, for example, to open the blood-brain barrier, which might have very neat therapeutical and diagnostic applications, but we'll see in the future. So Finland is in a fortunate position that we also have a LIFU machine, and it's located in Oulu. But it's important to note that as of now, LIFU is only in experimental use. So we still don't have enough research so that we could use it to actually treat patients. But hopefully that will change in the future. And this LIFU research is done in Oulu by Professor Vesa Kiviniemi, who you can see here in the right bottom corner. He has already also given talks about LIFU and its potential applications, and you can even find them in YouTube, especially if you're a Finnish speaker. Then if you put aivopesuri in YouTube, you will probably come across a lecture by Vesa. So I encourage you to check those out because I won't be going much detail in LIFU in this presentation. I will more focus on HIFU, which I'm more familiar with and which is used in a clinical setting at the moment. And also a brief mention that the focused ultrasound is already being used to treat, for example, different tumors, both urological, gynecological, even some brain tumors, at least in experimental use. But these applications are outside the scope of this presentation, so I will only focus on the neurological applications of this technique. So you are probably familiar that sound is a vibration that propagates as an acoustic wave through a transmission medium. So there always has to be some kind of medium, whether it's gas or liquid or solid. So sound cannot pass through a void. And most of you are probably also familiar with ultrasound. So when we talk about ultrasound, we mean the frequencies that are over 20 kilohertz. And that's the upper audible limit of human hearing. So ultrasound is a noise that we can't hear. And the frequencies of ultrasound can go up to several gigahertz. But it's still important to realize that it's still a similar kind of sound wave. So it follows the same physical laws as a normal sound that we humans can hear. And as you are probably familiar with, ultrasound has been used in medical imaging already starting from the 1940s, so for already a very long time. Then the focused ultrasound is a bit different method compared to the normal medical imaging ultrasound. So in this method, we focus ultrasound waves from several directions to a specific spot, which is illustrated here in the upper right corner picture. For example, in the HIFU machine that we have in Turku, there's, I believe, 1024 ultrasound sources coming from all over the head, and all these ultrasound waves are directed that they meet in a certain spot. And with that, we can reach a great focal intensity, and then the energy is absorbed to the tissues, which results in a rapid increase of temperature. And this rapid increase of temperature results in an almost immediate necrosis in a very small focal area without damaging the surrounding tissues. This is in theory pretty similar when you compare it to for example, radiation treatment, which is also used in a similar way that we focus it from many different angles to the same spot. But in this case, the upside is that the ultrasound waves themselves are not causing any damage to the tissue that they go through. So only the tissue where all the energy is combined is the tissue where a meaningful rise in temperature happens. And focused ultrasound is in a way a Finnish innovation. So it was developed by a Finnish-born physicist, Kullervo Hynynen, who was born in northern Ostrobothnia and studied first in Oulu and then did his PhD at the UK and then continued his international career in the USA and Canada, and is currently working in the University of Toronto as a professor. And his first publication suggesting the feasibility of focused ultrasound guided by MRI imaging were published already over 30 years ago in the beginning of the 90s. And now, if we fast forward many years and a lot of research, here's you can see some of the milestones in ultrasound research going towards the focused ultrasound we have today. And today we have developed many different techniques where we can utilize the focused ultrasound, including HIFU for ablative treatments and LIFU for example, neuromodulation or opening the blood-brain barrier. Here's also a brief summary of the different clinical research that has been done during the last decades about the use of focused ultrasound to treat movement disorders, and also nowadays other therapeutic applications are also being investigated. But to go through HIFU in practice, what actually happens there? Well, first we go through a patient selection. So this is definitely not treatment that is meant for every single patient with essential tremor or Parkinson's disease tremor. So we're looking for patients with a very difficult and very debilitating tremor that really hinders their ability to do things. But as you can imagine, a very difficult tremor can cause problems. For example, just writing or drawing can be completely impossible for these patients, and sometimes even eating can be a challenge if you can't really bring a fork or a spoon to your mouth. And also drinking without spilling can be impossible from a normal glass for these patients. And also we do have other treatments to treat tremor in these patients as well. So even today, the medical treatments are the first line of therapy. So most patients can get enough treatment response from this conservative treatment, and then there's no need for them to go to a invasive treatment like this. But if we do have a patient with very difficult tremor, which is treatment refractory, then they are a potential candidate for HIFU treatment. However, since we do have more experience using deep brain stimulation, and there's also more clinical research showing the efficacy and safety of deep brain stimulation. In most patients, we do prefer using that to treat refractory tremor. But of course, some patients are not suitable for deep brain stimulation, but they still can be suitable for HIFU. And also there are some patients who are offered deep brain stimulation, but they still decide that they would rather have the HIFU treatment for their condition. After the patient selection, we need to perform an MRI and also a head CT. So CT is also required because it gives us a better understanding of the what kind of skull the patient has, because people differ in their skull density, and the skull density affects the acoustic properties of the head. So some people are so thick-skulled that the ultrasound waves can't properly pass their skull, and that's why some patients can't go to HIFU treatment because of their skull properties. But fortunately, that is quite rare. So we're only talking of a few % of patients. So most patients have a skull that permits this type of treatment. And with the magnetic resonance imaging, we need the anatomical images of the head to see whether there are, for example, some major anatomical abnormalities, and also do magnetic resonance angiography to see the blood vessels of the brain, check for possible abnormalities in those. But MR imaging is also used during the procedure, both to find the treatment target and also to monitor what is happening when we're treating the patient with the focused ultrasound. So using the MRI machine, we can monitor the temperature inside the treatment area, inside the brain, based on proton resonance frequency. Don't ask me how it works, because it's too complicated and I don't know how to explain it, but it does work. Also, the practical standpoint that people need to consider is that the patient's head has to be completely shaved off from hair to avoid any even minor air bubbles between the machine and the patient's head, because the air bubbles absorb the energy of the ultrasound waves, and which leads to cavitation and a rise in temperature. So in the worst case scenario, it could result in burns of the scalp if we did not do this. And also because we are directing quite a lot of energy through the skull, we are also conducting some cool and gasless water around the patient's head. So they have a stereotactic frame attached to their head with this kind of rubber helmet that circulates the water around the skull. And then we also use the MRI post-operatively to see the resulting lesion. So here in the A figure, you can see the pre-operative MRI, and the green area there is the localized VIM nucleus, so ventral intermediate nucleus of the thalamus, which is our treatment target whenever we want to treat tremor. and it's been identified using tractography in this case. So we know that the dentatorubrophthalmic tract passes through the thalamus. So using the anatomical images and the tractography images, we can locate the limb quite nicely. And here in the figure B below, you can see the post-operative MRI with the resulting lesion quite nicely in the area that was targeted. And now, the Neuro-HIFU treatment started at Turku University Hospital at the spring of 2022. So we have already been doing this for over 2.5 years. I'm not completely sure about the total number of patients so far, but I would guess we're talking about over 100 patients so far. The basic protocol is, well, we get the referrals to neurology and we screen them whether the patient actually seems like they would be suitable for this treatment. Then we need to do brain MRI and MRA, as I discussed previously, and also the head CT. Then they come here to Duke's outpatient clinic to see a movement disorder specialist, so we can actually make sure that the diagnosis is correct. So it seems like it is actually essential tremor or tremor associated to Parkinson's disease, and that the tremor is difficult enough and treatment refractory, so it's worth going to this kind of invasive treatment. Then there's the actual treatment day here at the Turku University Hospital, and after that there's a follow-up visit again to Duke's movement disorder outpatient clinic, usually about 1 month from the procedure. So what happens during the actual treatment day? The patient's head is completely shaved if it's not done already previously. Then the neurologist there will do pre-operative testing. So we use so-called TRS scale that is very commonly used to assess tremor severity, and it's also a scale that was used in the original clinical research HIFU publications. And we also check the patient's balance, sensation, and motor function. So in order to identify whether the treatment has some adverse effects, because sometimes the patients may acquire some imbalance or some sensory abnormality or even ataxia or other problems with their motor function because of these treatments. But fortunately, this is usually a relatively safe procedure, and the adverse effects are most commonly transient. Then after the preoperative testing, the stereotactic frame is attached to the patient's head. You can see the stereotactic frame in the figure C below. So it's actually screwed directly to the skull, so it's very firmly attached. And the neurosurgeon does this in local anesthesia. And then the patient goes through another magnetic resonance imaging. So we acquire the images needed to localize the treatment target, which is the VIM nucleus, as I discussed previously. And then the neurosurgeon and the radiologist together decide on locations where to test thermal treatments. So the upside of the HIFU machine is that we can control the temperature while doing the thermal lesioning. So there is a window between the permanent lesion and no effect at all, where we can create like a transient lesion. So we can see what happens if we lesion that part of the brain without doing any permanent damage. So we do this kind of test treatments, usually at least 2 or 3 times, sometimes even more. And after that, the neurologist is in a hurry because we have to do a very quick testing because the effect only lasts for 1 to 2 minutes. But then we can check whether the patient still has tremor, how much the tremor has decreased, and also check for potential adverse effects by testing and interviewing the patient. And once the neurosurgeon and the radiologist and the neurologist are in agreement that, well, this area that we targeted seems to be the hotspot we want to target in our treatment, so it results in a good efficacy, decreasing the tremor, and does not result in any major adverse effects, then we do the permanent thermal lesioning. So we go above the point of no return temperature, which results in a permanent lesion and usually even more efficacy towards the tremor. And then the neurologist also does post-operative testing after this treatment. So all in all, this usually takes like at least I would say 2 hours minimum. So usually we treat 2 patients per day here in TYKS. And as I said, the adverse effects are usually very minor and transient. So the patients can usually return back home quite often the same day as the treatment was given. And here's an example of the treatment results. So we usually ask the patients to do some drawings on a paper. So, for example, to draw a spiral or a straight line. And here in the A figure, you can see what those looked like before the actual treatment, and in the figure B, you can see the results after this kind of test lesioning without the permanent lesion. So where you can already see that the tremor is greatly reduced, but you can still see some residual tremor. And in the figure C, you can see the final result with the permanent lesion, where the tremor is basically completely absent. Now, because of the time limits of this presentation, I can't really go into specifics of all the treatment going on with the focused ultrasound and its possible applications in the future. But quite briefly, the HIFU treatment is being experimented on to treat dystonia and also dystonic tremor. And it has shown some promise also in some psychiatric conditions, including obsessive compulsive disorder, depression, and anxiety. And there are also case reports about neuropathic pain and focal epilepsy that have been very promising, but the amount of patients suffering from these treated with HIFU is still very low. So we still need much more research and much bigger trials to actually see whether HIFU is efficacious enough and safe enough to treat these kind of symptoms in a patient. Then going to the other type of focused ultrasound, so the low intensity modality, at least when you listen to Oulu's Professor Vesa Kiviniemi, he's very excited about the potential treatment of different neurodegenerative disorders. So there are some preliminary results that show us that opening the blood-brain barrier with LIFU can result in getting rid of these different kind of harmful substances in the brain, such as amyloid and tau protein and so far. So in the Finnish media, there has been a lot of talk about the aivopesuri, which means the brain washer machine. So the hope is that in the future we could use this machine to get rid of unwanted substances in the brain, which could potentially treat different neurodegenerative diseases. But at this moment, it's still too early to say whether this will work. But we'll see. It's going to be very interesting. Also, in addition to the different neurodegenerative diseases, we know that opening the blood-brain barrier can be convenient, for example, to treat tumors. Because for example, talking about the brain tumors, they are usually more difficult to treat compared to other tumors of the body, because the blood-brain barriers effect to block different molecules to pass to the brain tissue. So at least in theory, we could use LIFU to focally open the blood-brain barrier around in the area of the brain tumor, and then deliver chemotherapeutics there through the bloodstream, for example. And also there have been preliminary results that we could also perhaps use the LIFU machine to do this kind of liquid biopsy. So again, the idea is to use LIFU to open the blood-brain barrier around the tumor, and then it would permit certain molecules from the tumor to pass into the bloodstream, and then we can take a blood sample and see what kind of a tumor it is from that. So that's also, at least in theory, a future application for this machine. But as I said, it's still at an experimental point at this point in time. LIFU has also been shown to be useful in neuromodulation, and there are ideas how to utilize this in the neuromodulation to treat, for example, epilepsy or different spinal cord or different spinal symptoms. But with those as well, more research is still needed. And lastly, I will talk a little bit about brain lesion research in general, and how this might provide us with new treatment targets in the future. As many of you probably know, the functions of the brain have pretty much been discovered by different brain lesions during history. For example, the discovery of Broca's area here, and the lateral aspects of the dominant hemisphere, which is responsible for producing speech. And then there's the story of Phineas Gage, who suffered a frontal lobe damage due to an accident, and went through a very radical shift in his personality. Now, the common lesion symptom mapping in theory has been very simple. So if we have different patients with different brain lesions with the same symptom, if those lesions come together in a certain area, we can deduce that, okay, this is probably the reason for this symptom. However, further research has shown that most brain symptoms don't work in that way, but usually we can have different patients with the same symptom with different lesions that don't overlap at all. And the reason for this is that the symptom is not caused by certain area of the brain, but it's more a network disorder because the different parts of the brain are connected to each other. So the resulting symptom is because of a damage to this network of the brain. So this has already been shown in many different brain disorders, for example, localizing Parkinsonism to the colostrum, and we localized the limb ataxia to intermediate cerebellum, for example. And in addition to researching the foundation of different brain disorders, we can also try to map therapeutic targets from the brain. For example, in a paper published by my thesis director, Juho Joutsa, they showed that different lesions resulting in a decrease of essential tremor were connected to a common brain network, the hub of which was inside the VIM nucleus of the thalamus. So since we already know from previous research that this is a very good treatment target to treat tremor in both essential tremor and Parkinson's tremor, this is a nice illustration of how we can utilize lesion network mapping to find new potential treatment targets in the brain. So at the moment we are utilizing this in the brain project here at the Turku University. So the main limitation of the previous lesion network mapping research is that the available lesion data for different symptoms is limited. And also the lesion network mapping studies so far have used mostly retrospective data, which can result in different problems like publication bias, causality, and very heterogeneous patients and symptom descriptions and insufficient imaging data. So in the brain project, which I'm also working on, we're aiming to prospectively collect a large database of brain lesions caused by stroke and to screen what kind of symptoms they cause. And then we can apply lesion network mapping to identify the origin of different neurological and psychiatric disorders, and then hopefully provide novel potential neuroanatomical treatment targets for future clinical trials. So we're aiming to recruit over 1,000 or even up to 2,000 patients who have recently suffered an infarction or intracerebral hemorrhage. We are gathering these patients at the Turku stroke wards, and currently we already have over 1,250 subjects recruited. And now we do a thorough neurological examination and a clinical interview and many questionnaires 3 times to these patients. So first at the ward when they are treated, then at a first follow-up about 4 months after the stroke, and then at a late follow-up at approximately 3 years. And then we extract the imaging data from this as well. And here's a long list of different symptoms we are studying in brain. So there's going to be a lot of data to go through in the future. But to come back to the original topic of this talk, the MR-guided focused ultrasound, it is a very promising treatment that is already used in many places around the world, and I think over 100,000 patients have already been treated with this. And there are definite pros in this technique since it's incisionless and overall much less invasive than any normal neurosurgical interventions. So we don't have to open the skull to create a lesion in the brain. It's also very convenient that this technique does not require any general anesthesia, so the patient is awake, so we can get immediate feedback from them if they get, for example, some adverse effects. And also there are some definite risks with general anesthesia, so some patients are not suitable for that in any case. And also we already know that the MR-guided focused ultrasound is highly precise. So the lesions that the HIFU produces are about 1.3 to 1.3 to 3 millimeters in size. So we're talking about the millimeter level lesions that we can create with this. Now, there are, of course, some disadvantages to this technique. The main one being probably that the lesion that we create is permanent. So if it results in adverse effects, those can be permanent as well. It's a fairly new technique, so even though we do have long-term results for some treatments for up to several years already, there's still not sufficient data to say what's like the prognosis for these patients for the rest of their life, and whether there will be some adverse effects that come up in a more long-term follow-up. Also, especially compared to deep brain stimulation, there is no way to fine-tune this afterwards. So when the lesion is done, it's done, and we can change the result. Whereas with the deep brain stimulation machines, we can modify how they work quite a lot and still get better treatment results and less adverse effects by doing this fine-tuning post-operatively. Also, currently, HIFU is limited only to tremor treatment and only in essential tremor and Parkinson's disease tremor. I do believe that probably in the future we will be using it to treat, for example, dystonic tremor as well, but at least for now, it's still not approved for that. And HIFU is also not suitable for all patients. So as I said, the skull density ratio has to be high enough for this technique to work, and also the patients have to go to an MRI machine, and some patients can't do that. For example, they might have some other therapeutic device inside their body or other contraindications which prevent them from going to an MRI machine. And then there's, of course, a need for the head to be shaved. So usually, at least for older male patients, this is not a big problem, but some patients might find this a bit troublesome, that they need to get rid of all their hair for this technique. Here are the references for more information about this, and that was it. Thank you. Do you have any questions?
Great. Thank you, Jaakko, for your interesting presentation. If you would like to know more about Neuro-HIFU, I also have added a message to the chat, so you can, if you want to read TBMC's latest digital magazine, which includes information about Neuro-HIFU. But yeah, if anyone has any questions for Jaakko, please write them in the Q&A section of this webinar. And if that doesn't work, you can also write a message in the chat instead.
I already see in the chat that Kaisa Unkila has asked how HIFU works in ALS patients. Well, it's a good question. So if I remember correctly, they used it to target the motor cortex, and they tried to remove the harmful substances causing the neurodegeneration from there. But to be completely honest, I can't recall what kind of biomarkers they used for this, and it was a very preliminary study. So this is by no means proven to be efficacious in those patients, but it's just an example about the potential applications that still need more research in the future. Any other questions?
If there are no other questions, I would like to thank you, everyone, for joining us today, and hope you have a nice remaining week.
Thank you.
All right, let's end this. Thank you. Bye.